Hi, everyone. My name is Allison Yoder, and I am a fellow through the Academy of Nutrition and Dietetics Foundation, focused in food retail nutrition program development. In 2019, the Academy Foundation received a grant from Walmart for a new project titled Leveraging Dietitians in the Food Retail Environment to Improve Public Health. And I came on board in June of that year. And since then, we've been looking at opportunities on how to integrate food as medicine interventions within both current as well as future food retail nutrition programs. And through our research, we've developed a conceptual definition for food as medicine. We've identified pathways to intersect the role of dietitians within food retail settings, and we've provided recommendations to integrate food as medicine programs within current retail nutrition models. So why are we focused on the concept of food as medicine, particularly within food retail settings? According to the latest data collected in FMI's Food Retailing Industry Speaks report, health and well-being and the food as medicine trend remain as top factors that are positively impacting sales and profits for food retailers. And as health and well-being continues to thrive, we're recognizing that consumers are leading the charge in setting food and health trends. This makes food retailers critical allies in building momentum for food as medicine interventions. The food retail environment is increasingly being used as an avenue for access to health services, particularly in underserved populations, and the omni-channel approach to the retail setting. So this includes the physical store, digital nutrition solutions, but also e-commerce online shopping. This provides a unique opportunity for dietitians to address gaps in healthcare equity by providing much needed access points and the ability to connect consumers. Also, the structure of food retailers, so having stores regionally, as well as nationally, many of those in rural communities, but also the structure of retail nutrition programs, employing dietitians at the corporate, regional, and store levels. This allows for the scalability of food as medicine programs. So as part of my nutrition and food retail fellowship program, we assembled an expert advisory group. And this was made up of 24 individuals who really span diverse perspectives within both the food retail as well as the food as medicine professions, ranging from retail, business, healthcare, community, research, and education. The advisory group, we convened at a 2-day roundtable meeting in November of 2019 to determine how food retailers can implement a food as medicine concept within the food retail setting, but also utilizing registered dietitians. Now, this conceptual definition of food as medicine, this resulted from the roundtable meeting with really 3 primary focus areas identified. Food as preventative medicine to promote health and well-being, food as medicine in disease management and treatment, and food as medicine to improve food safety and nutrition security. This conceptual definition is grounded in science to ultimately connect food to health in responsible and practical ways. Our retail nutrition programs and outcomes scoping review was recently published in the Journal of the Academy of Nutrition Dietetics, and it further supports the food as medicine definition and the framework that we've developed through the fellowship program. So within the scoping review, we analyzed the landscape of food retail nutrition programs, as well as food as medicine interventions, to really get a better idea of what types of programs were out there. But we also wanted to take a deeper dive to see which types of programs had an improvement in health outcomes, but also while producing a positive return on investment. So within the scoping review, 5 program model categories were identified: prescription programs, incentive programs, medically tailored nutrition, path to purchase marketing, and then personalized nutrition education. So a prescription program operates like a traditional prescription. It allows dietitians and other health professionals to prescribe subsidized food. Food incentive programs, on the other hand, can range from providing coupons and vouchers to discounted pricing on food categories, such as fruits and vegetables, rebates in the form of cash incentives and discount coupons, but also disincentives, such as taxes on certain food items. With medically tailored nutrition, this provides a more comprehensive therapy for patients who really could benefit from improved nutrition. So with this model, a dietitian or another healthcare provider writes a prescription for the patient to receive tailored meals or boxes of food. And these are going to align with the patient's health condition or diagnosis. With path to purchase marketing, this includes program models that are designed to produce behavior change, but also environmental change right at the location where selection of food for purchase occurs. And then lastly, the personalized nutrition education. This includes individualized approaches to health and well-being that engages dietitians and also nutrition resources directly with the consumer. This can happen again, both in person or virtually, but ultimately resulting in positive behavior changes. So our scoping review resulted in 4 key findings. First, we found that food as medicine interventions in the retail setting are shown to be successful in producing either positive health outcomes or cost effectiveness as single category interventions. Path to purchase marketing, as well as incentive programs, produce the most positive outcomes as standalone program models in terms of increased sales and revenue. But personalized nutrition services also contributed in producing positive behavior change. And this was through healthier shopping purchases and improved eating habits. Our second key finding shows that both return on investment for the retailer, as well as improved health outcomes for program participants. This was also achieved when multiple category interventions were implemented. So studies that demonstrated the most effectiveness with producing both health outcomes and return on investment for the retailer, this included a combination of program models. So we have incentive programs, and this did include prescription programs and medically tailored meals when they were combined with an incentive program, personalized nutrition services, and path to purchase marketing. So while several of these categories did produce a positive outcome as standalone program models, it's really important to note here that the greatest opportunity to integrate food as medicine with both existing and future retail nutrition programs. This was shown through multiple category program models. Now, our third key finding supported the foundation for which we built the conceptual definition from. Food as medicine interventions, as well as retail nutrition programs, they encompass 3 different focus areas. Food as preventative medicine in the promotion of health and well-being, food as medicine in the management of chronic disease, and food as medicine to improve food and nutrition security. And our last key finding found that dietitians are mostly involved in personalized nutrition education categories. This is either as single strategy or multi-component interventions. And dietitians are often utilized as part of an integrated team of professionals. So this includes physicians, nurses, pharmacists, and chefs. And finally, as a result of both the outcomes from the advisory group roundtable meetings, as well as key findings from the scoping review, a food as medicine retail nutrition framework was developed. And through this framework, services, programs, promotions can all be developed to really meet the unique needs of retailers, again, based on their current health and well-being priorities. So having an understanding of target shoppers and really knowing how they fit within food as medicine focus areas, this is going to allow retailers to be better positioned and better able to leverage product selection, marketing strategies, and services. This framework also highlights recommended food as medicine program models to implement within each of those 3 identified focus areas. So for example, if you're trying to promote health and well-being and you're wanting to target families, you really should consider a combination of incentive programs, personalized nutrition education, and also path to purchase marketing. So for a family meals promotion, a food retailer may want to consider having a meal solution resource available right at the point of purchase. This could be, again, in store, but also on their website or e-commerce site. And then they could pair this with telenutrition visits with a registered dietitian, or even have a dietitian live chat feature on their e-commerce site. In combination, you could also consider pre-made meal solutions that correspond with the retailer's weekly ad, or maybe feature items that are on sale that week. So as you can see, the combination of programs and incentives are endless, and this can be completely tailored to the needs and the priorities of each food retailer. So to build upon the retail nutrition framework, a white paper is available for download on the Academy Foundation's website. And within the paper, we go into way more detail outlining the current landscape of retail health and well-being, but also the implications for food as medicine programs. So this includes focus areas, the target shoppers, and even the recommended program models. Within the paper, we also outline key elements of a successful retail food as medicine program, and we highlight current successful food as medicine retail models. We also have several resources that are currently in the works with the fellowship program to, again, further support food as medicine programming, but also the value that retail dietitians bring to the table in leading these efforts. Food insecurity webinar recording is available on the Academy Foundation's website. And during the webinar, we focus on resources that are available to assist with food and nutrition security benefits, but also identify strategies on how dietitians can further support their customers. There's also a food as medicine retail nutrition video that's on the Academy Foundation's website. And this really markets the food as medicine framework that was developed within the fellowship program. We are currently working on an evaluation toolkit that is aimed at retail nutrition programs, and we're going to be conducting pilot opportunities with retailers soon to evaluate the outcomes of food as medicine program models. And lastly, we're continuing to focus on supporting the skills and the knowledge of retail dietitians through additional training opportunities. So we have a certificate of training program for current dietitians, but also a dietetic internship curriculum for future dietitians. And I've included my contact information here. Please do not hesitate to reach out to me if you'd like to chat more about food as medicine and also the Academy Foundation's fellowship program. Thank you.